Right, we're going to start with a lower body assessment. And when you start a lower body assessment, you want to start with vital signs. So for vital signs, you would need a stethoscope, blood pressure cuff, a watch, and then since I showed that in the last video, I'm not going to do it this time. The first step, we would start with the musculoskeletal system. So you will start with inspecting and palpating the hips. The client should be lying in supine position, so go ahead and lay down on your back. And with the legs slightly apart and the toes pointed upward, dog's a little bit in the way for this one. You want to palpate the upper hip and thigh joint, which should be right here. And then you just want to make sure it's firm, stable, and non-tender. Next step is range of motion. With the client lying in supine position, have the client raise their leg off the table, so go ahead and raise your left leg straight, which is called flexion of the hip. And go ahead and go back down. And then have the client raise their leg, bend the knee towards the chest, flexing the hip. And then go ahead and relax. And then the next range of motion exercise would be having the client bend the knee, keeping the foot on the table, so go ahead and bend your knee up, and then bend your knee towards the midline of your body. No, and lay down, and then bend it towards this way. Alright, and then go ahead and relax. And this is internal rotation of the hip, and then for the opposite, you would have move the knee away from the body for external rotation of the hip. Alright, and then the next would, again with the client lying flat on the table, move the leg away from the midline, straight, away from your body. There you go. And this would be abduction, and then moving it back forward would be adduction. Again, alright, now go ahead and flip over onto your stomach if you would. And have the client lay prone. You would want to ask the client to raise one leg off the table, keeping the knee straight, and this is hyperextension of the hip. Go ahead and relax. To test for muscle strength of the hips, with the client lying in supine position, so go ahead and roll back over for me, please. You want to provide resistance by placing your hand on the thigh while the client raises the leg without bending the knee. Alright, go back down. And then you want to place the hand on the lateral side of the knee and have the client abduct the hip towards the lateral side and back in. And then you want to place your hand on the medial side of the knee and then adduct in. There you go. Alright, now for inspection and palpation of the knee, go ahead and sit up for me. And then have your legs dangle off. You want to inspect the knee with the client in sitting position, and normally they would have a gown on, so you wouldn't have jeans, but and you'd have a table high enough where their legs could hang freely. Normally the knees should be symmetrical and free of lesions. You want to inspect the quadricep muscle of the anterior thigh, which would be up here, and then the muscles should be symmetric. Palpate the knee with your thumb placed on one side, which probably go from the front, and the second digit on the other side of the knee. Start palpating above the patella and palpate downwards gently over the entire knee. Normally the muscles are firm and there is no tenderness noted. You also want to palpate the tibiofemoral joint by palpating the lateral side of the knee. Normally the joint is firm and non-tender also. Moving on. To test for the bulge sign with a client lying in supine position, just go ahead and lay back down. Assess for fluid in the suprapatellar bursa with your first and second fingers stroke above the medial aspect of the knee. Applying pressure to the lateral side of the knee and observe the medial side for presence of fullness of fluid. So pressing on one side, you would observe for fluid over here. And then for range of motion of the knee, Also with the client lying in supine position, you want to have the client bend the knee and raise it towards their chest. So go ahead and bend up and raise toward. And then return back to original position. To test the muscle strength by having the client bend the knee and raise it upward towards the chest, you provide resistance above the knee, so you're doing the same thing, but go ahead and do the same thing. And you're resisting above to test for strength. And go ahead and relax. We'll go ahead and you also want to test the client when they're walking to observe a steady gait. We won't do that at the moment, but to inspect, palpate ankles and feet. You want to inspect the feet and ankles while walking, standing, and sitting positions. Normally the skin will be uniform with color in each position. There should be no apparent evidence of swelling or skin breakdown. You want to palpate the ankles with your thumbs on the anterior and lateral side while holding the heel of the foot in the hands. Go ahead and switch this way for me, thank you. Normally the joints are firm and non-tender. You want to also palpate, go ahead and relax this leg, palpate the posterior ankle, which would be the Achilles tendon. Normally the area is free of pain, tenderness, and nodules. You also want to palpate the metatarsal phalangeal joints. Joints should be firm and non-tender. So normally when doing this, you would have table this way and then holding the foot up here. To test range of motion of the ankles and feet, the client should perform certain movements. Dorsiflex the foot by bringing the toes towards the ceiling. There you go. And then plantarflex the foot by pointing the toes towards the floor. Position the sole of the foot outward and then inward, so in and out. There you go. And then flex the toes by curling them downward. There you go. Abduct the toes by spreading them out in a fan pattern. Next the toes together for abduction. You want to test the muscle strength of the ankle by dorsiflexion and plantar flexion against your resistance. So push against my hand. Alright, and then back up this way. Okay. And then you want to palpate the interphalangeal joint. Normally there should be no pain or tenderness, and the temperature is the same as the rest of the body. Go ahead and have you sit, and then pull your feet up here again. Next, you want to inspect and palpate the spine. With the client standing, go ahead and stand up. Inspect the spine. Normally the curvature and lumbar curvature is concave, and the thoracic curvature is convex. You want to observe the length of the spine for lateral curvature, and observe the level of the right and left scapula. Normally, they should be on the same plane. Observe the right and left iliac crest. They should be on the same plane. You want to palpate each vertebral process. Normally, they are in alignment and non-tender. You want to palpate the muscles on each side of the neck and back. And those should be non-tender as well. Range of motion for the cervical spine. Alright, with the client standing, have the client perform certain movements. Have the client touch the chin to the chest, and this will be performing flexion. And then you want to have the client look up to the ceiling, and this is hyperextension. Go ahead and relax. Next, the client should have to bend the head to the side by trying to touch the ear to the shoulder without moving the shoulder, and this is lateral flexion. And finally, you want the client to turn their head to one side as far as possible, and then the other, and this would be testing rotation. Next, for range of motion of the thoracic and lumbar spine, continue standing. Place your hands on the client's pelvis, and you want to stabilize the client while the client bends to each side. Go ahead and bend your whole body. There you go. And this would be lateral flexion. Moving on. You want to have the client twist at the wrist at their waist by rotating the shoulders back. So go ahead and rotate this back without turning your hips. There you go. And back. You're going to do both sides. Alright, go ahead and have a seat. And that is the end of musculoskeletal.